का बहुत बहुत शुक्रिया जिन्होंने इस प्रोग्राम को नज़ाकत दी और इसको पूरी तरह से पब्लिक के लिए, पब्लिक इंफॉर्मेशन के लिए लाइव किया। मैं आपका बहुत बहुत शुक्रगुजार हूँ। ये जो प्रोग्राम है क्वालिटी हेल्थ केयर हॉस्पिटल, यू नो इट्स इन द पेरिफेरल डिस्ट्रिक्ट ऑफ द कंट्री, बॉर्डर डिस्ट्रिक्ट ऑफ द कंट्री। यहाँ से जो पेशेंट्स रेफर हो जाते हैं either to the children's hospital or to the Sikkim's or the neonatal intensive care unit, when we have sometimes the premature deliveries, when we have sometimes the baby asphyxia, when we have the jaundiced babies, then we don't have so many these phototherapy units or the resuscitation units. So we did put up in our mind, since we are running a hospital, the whole district is doing the cesareans or the normal deliveries. Complications are known. We need the baby as well as the mother. That is the positive outcome of a healthy pregnancy. If we lose baby and mother survives, that means 9 months are waste. So this baby is very important. आप देखो उन लोगों का हाल जिनके पास बच्चा नहीं है, कितनी स्ट्रगल वो करते हैं कि बच्चा हो। IVF, इन वो फर्टिलिटी, इसलिए हमने ये सोचा मुनासिब कि निको न्यूनेटल इंटेंसिव केयर यूनिट और पीको इस पीडियाट्रिक इंटेंसिव केयर यूनिट, हमारे पास इंटेंसिव केयर यूनिट ऑलरेडी है। दैट मीन्स अगर हमारे किसी पेशेंट को चाहे मेडिसिन का हो या सर्जरी का हो, सर्जरी के बाद कोई कॉम्प्लिकेशन हो जाए, वो टेक हिम इन द ICU। इसी तरीके से पीडियाट्रिक सर्जरी हमारे पास इम्प्लांट है एज पर आयुष्मान, या न्यूनेट जो डिलीवरीज हो जाती हैं हमारे हॉस्पिटल, दूसरे हॉस्पिटल, दे कैन टेक एडवांटेज ऑफ दिस रादर देन शिफ्टिंग दिस पेशेंट टू far-flung area. Sometimes the ambulance is not such a type. Of course, we have the critical care ambulance which is fully equipped with the oxygen, with all the staff, trained staff, but always they may not get it. So they may die on the way. We have the traffic hurdles, the population is increasing, the transport is increasing. So we have thought this at the doorstep. All the hospitals, all the government sector, whether from Tangdar, Karen, Handwara, even all the North Kashmir, they can utilize our this neonatal intensive care unit, which is governed by a pediatrician and by the critical care specialists around the clock. We have the phototherapy units also. Another is pediatric intensive care unit. Yes, we are starting a pediatric ward, we have already, but we do find sometimes when the patients don't get a bed. See, when you refer here asphyxiating or a dying baby, he could be saved here. We have many examples. From the CHC Kupwara referred, from this hospital Handwara referred many patients. So rather than going there and wasting time on the way or waiting for the bed there, they can take this opportunity. And we are thankful to the Deputy Commissioner Kupwara, administration, our armed forces who joined us, our paramilitary forces, BSF, and other people, the military fraternity who joined us to make the people aware that we have this facility at the doorstep. In addition, this is covered under PMJY, that is Ayushman Bharat. Ayushman Bharat has scheme that if we admit the baby here, they have to pay just on the mother's or the father's golden card. They will be admitted and there will be no charges for them. Similar, it is in the government. So we are providing the government, like the government we are providing. We are a part of the government. We are running that scheme. So they can get a better state-of-art infrastructure in our hospital, whether this is hemodialysis, whether this is surgery, whether this is laparoscopic surgery, any surgery, urology, general surgery, or general medicine admissions, so they can avail this facility here in our hospital. This was the objective to highlight it, make the importance to this PMJ Sehat scheme, and of course, the digitalization, the artificial intelligence, which is revolutionizing the healthcare. We have fully digitalized the hospital. All our appointments to online. Any patient, any person can book online appointment. We have launched the telemedicine. Anyone can, from any part of our state, any part of remotest area of our district, can just put on WhatsApp his little details. Will be back to him, will respond to him, will book his appointment. The specialized doctor whom she wants will contact him and give the advice. So that means reaching those. That's how telemedicine and this AI has revolutionized the world. Not only that, there are some diseases which can be predicted earlier. Suppose, see the lifestyle have changes. AI does not do anything. AI will not replace the doctors. It collects the data from millions of the people that it statistically standardizes that who are the people who get diabetes over a period of 3 to 5 years, who are at low risk, who are at moderate risk, who are at high risk. Similarly, the heart attack. See how many youth we are seeing. So isn't it good? It's not revolution that if a person comes to know that he's going to die of heart attack, he has a high risk at heart attack, that means he has risk factors, he has family history, these are the parameters, his lifestyle is not good, he has hypertension, he has other risk factors, cholesterol and triglyceride ratio is more. These are many factors, our cholesterol ratio is more. And we have the gadgets in the AI. These are wearable. You can see this smartwatch. This is telling you all the daily activities, how many calories, what you have done, what you are doing. There will be other variables which are inside the hospital or which will be taken by any normal person with him, and he'll be monitored. So he'll be alerted by this. If he has an arrhythmia, we have HVR. Suppose the cardiac, I'll give example, heart attack, who will get it? HVR is heart rate, HRV is heart rate variability. So if it is high, it is safe. That means if you are doing exercise, if you are doing some stress, your response to that is very good. Your heart is resilient. That means the risk of heart attack is less. And you don't have other risk factors. That means the cholesterol is low. So you have the low. If the HVR is low, that means if you take little exercise, if you have little beats, difference in the beats, see what AI is doing. It will see in 24 hours if there is a difference of if it takes 0.85 second in one person, if sometimes it takes 0.92 second for a beat, it will record it. That means something is there. If you do the echo, that shows early valve motion abnormality. If you do the coronary angio, that will the calcium index. That means how AI will predict that this person is having the high risk. If low HVR, high cholesterol, and he has other risk factor like diabetes or hypertension, he is going to have in 5 years a heart attack. So how this AI is helping? This how it will transform the world. We have to be with it. We have to take it open-handedly. Those lifestyle changes will be there. We will be given the dietary plans will be there. You will personalize your treatment. If you see the drug discovery, if it's taking the years drug discovery and research, it is taking months in that. Just the data. Just the data. So in healthcare sector, that there are already AI things which are incorporated into it. So this is with us. We have to be with the wind, not behind the wind. We have to move ahead. So this is the first hospital we are proud that we are fully digital as per NABH guideline, silver certification. We have already applied for that, and we are got that being an NABH accredited hospital. So this is a paperless, online booking, online appointments, paperless, no time wastage, and you will have the best treatment.
Thank you.
We can give the referral, whosoever requires. We can talk about the second opinion. So that is important to healthcare. Thank you very much for your conveying the message to the public about this, our facilities and the artificial intelligence which is coming in a big way.
Thank you.